Hello, welcome back to the Physical Therapy San Pedro podcast. This is episode 56, and today we are discussing developing mental toughness. I am your host, Dr. Janae Brown, and today I have a special guest, a very, very, very special guest, a friend and colleague of mine, Dr. Jason von Steitz. Thank you, Dr. Jason, for joining me.
Thank you for having me. This is exciting.
Super exciting because I have not had you on a podcast. We've been talking about it for a long time.
Yeah.
Haven't we? Yeah. Dr. Jason and I became colleagues and friends through supporting a local semi-professional WPSL team. We said that slowly. Soccer team that's in the area. FC Premier. They've had a few name changes, so it's kind of hard to keep up with that.
Yeah.
You know, it's like, what is their name today?
Yeah.
But just giving you a hard time, Coach Aaron. So we both have supported their team, and we've done some workshops together and some trainings with them. And then I've actually utilized Dr. Jason. We're going to refer to him as Dr. Jason going forward for some team building activities for my team here at Physical Therapy San Pedro. So I really respect him, and he's a great provider and clinical professional. So I'm bringing him on this podcast for a special episode for you guys because May is Mental Health Awareness Month. And so we want to just give y'all some tips and, give you guys some extra education this month and bring him on and just share all the good juju he has for you. So, Dr. Jason, I know a lot about you, but our listeners don't. So why don't you share with me just a little bit about yourself, what you do, and what you do every day and your specialties, and tell us about you.
Thank you. Yeah, thanks for having me. I have good juju, and that's part of what I do. But I'm a psychologist. I work with a lot of athletes. I'm in two different group practices. One CBT SoCal, another one Mental Fitness Clinic. Where I specialize in working with a lot of athletes, but people in general with OCD, anxiety, insomnia, and sport performance issues. Way back in the day, as a young lad, I was a sports psychology intern at the Major League Baseball Youth Academy in Compton. So that was a really great experience. After that, as a part of my graduate training, I was a sports psychology fellow at Whittier College, where I had a joint position, a position that was kind of housed within the counseling center and the athletic department. I also do a lot of team building sessions at the team here at San Pedro, Physical Therapy San Pedro. And then, I also work with I worked with the Whittier College athletic trainers, their sports medicine, and just different teams, different groups. I try to do fun activities and incorporate mental skills training into those activities, like improv comedy. That's a fun activity where people have pressure, but they need to focus anyway, and that gives them a great opportunity to practice their mental skills. And then I also host two podcasts. One's called Movie House Sports Psychology, where I talk to guests about their favorite movies or TV series through the lens of mental health and sports psychology. So love to have you on sometime. That'd be great. And I also host a new podcast called The Mentally Fit Athlete, or I'm one of the co-hosts on that podcast, where we try to give some really concrete, practical takeaways for coaches, athletes, or anybody interested in sport performance or wellness.
Wow. 2 podcasts. And I thought one was big. But, you host 2. So that's really exciting. So basically he has a 1-up on me. And I did ask him for some tips in the beginning, but I kind of know what I'm working on. So, but he's an expert in this area. So yes. Well, you have a lot of great things in your resume. You're doing a lot of great things for athletes and for the mental health for the community. So thank you for all you're doing. And we really appreciate having you here. So now you guys know he's vetted himself. He knows what he's talking about. So listen up. We got some good stuff for you. So let's dive into our topic. We talked about coming up with a topic that we felt like would fit our clientele. We see patients and clients in our center from really young ages, so like youth all the way to geriatric age, but we have a niche patient, which is like the active person. And we call them an athlete, and we kind of train everybody like an athlete. So when we're working with people who are injured, who we feel are athletes, going back to yoga, sports, soccer, baseball, the gym, like active people, it's not always easy to be out of sort of the thing you love to do, or not be able to exercise and work out, or not be able to participate in the activity or the sport you love. And that could be very frustrating. So today, what I wanted to, talk about with you is how we can help our athletes and our active people develop mental toughness when they have an injury, and, what are some tips, and, juju you have to give them so that they can work through this, and just a little bit about sort of what you would do with a client that might have this problem. So, or struggle with mental toughness. So let's start with the basic version of what is mental toughness. If you were to describe, and give us that definition, it'd be Dr. Jason's definition,
Sure,
right?
sure.
Not Wikipedia.
Sure.
But give us the Dr. Jason definition for mental toughness.
Yeah, that's a great question. So part of my dissertation, and I'm not going to go all into my dissertation,
Ooh,
but I
please.
I did
Please.
research mental toughness, and one of the things that I found was just pretty much every psychological trait that was somewhat positive and somewhat helpful was included in mental toughness, and there was all these different definitions. And in general, the different definitions have to do with resiliency and bouncing back from setbacks and staying focused under pressure. So I would broadly include those ideas to be able to face pressure, tolerate distress, and bounce back from setbacks. But one of the things that people often miss that I want to emphasize, people often think of mental toughness as, being really like, pumped up and, just sort of having the eye of the tiger, and that's great. But I would also want to include enjoyment, being able to be in the present moment, enjoying your sport, enjoying what you do, and having more emotional awareness. Because a lot of times athletes can just block out their emotional experience and not really be aware of what they're really thinking and feeling. And that's helpful sometimes when people need to really push through a tough moment, but things that don't bend break. So it's really important to be able to be aware of how you're feeling, and and enjoy what you're doing versus being an athlete who can hit his head against a wall or her head against a wall over and over again, because that's only going to last for so long.
Mm-hmm. Mm. Sometimes I want to hit my head against the wall. Don't we all? But
Yeah.
I don't know that would make my mental health better. So
Probably not.
Probably not. Okay. So
Yeah.
why do you think athletes struggle with, mentally with an injury? Like what makes them struggle? Give us, there's probably some obvious ones, but break it down for us. Why do they struggle?
Sure. Yeah, that's a great question. So a lot of athletes have most, if not all, of their identity and their self-worth tied into their sport. They think of themselves as athletes first, or competitors, or winners. And that's great. And when they think about what they really like about themselves and what makes them unique or worthwhile as a person, they often think of their sport or their ability in their sport. But people are a lot more than that. And when they get injured, at least for a while, that's on hold. And then also it could just be over for them, because oftentimes athletes will have a career-ending injury that's really unfortunate, but it does happen. So that's something to be aware of, that their identity and their self-worth is tied into their sport.
Yeah.
Then
I think this is your next one here. So,
okay.
I got you all confused in this.
Okay.
So your next one is, so essentially what you're saying is if an athlete feels like this is who they are, I am a soccer player. I'm a gymnast. I only, I've been playing baseball since I was 8 years old, and now I'm like, 17. I'm a
Right.
senior in high school, and I can't finish out my senior year. Like that identity, but that is who they are. They have a hard time separating, which makes it hard for them mentally.
Right. Absolutely.
Interesting. Yeah, that would make sense. Okay, your second tip on here. You said here separation from team, friends, and support system. Give us some more on that one.
Sure. Yeah. Yeah. So for a lot of athletes, especially, collegiate athletes, high school athletes who spend all their time or much of their time competing or training, their whole friend group, their whole support system is tied into their sport. So it could be their teammates, it could be their coaches, it could be, people who support them, maybe kind of like fans or friends who think of them as athletes. That's their entire, social group. So when they're injured and they're not at practice or they might be on the sideline, they're disconnected from that. And they're not getting the praise, they're not getting the feedback that they really enjoy and that helps them to feel good and feel like themselves.
That's a big one. That makes sense. Like all your friends all play soccer with you and you're injured, so you can't practice with them. You can't play with them. And so you're like, well, their friends are all together at, lunch or after school talking about the game last week. And you're just like, yeah, this is just, I didn't get, like, it's hard. That could be so tough. I didn't get to play. I can't relate. I don't know what happened when that person pushed me over on the ground or pushed somebody over on the ground and I wasn't there. I could see how like that could be difficult. Also, I remember a time when friend group wasn't a word.
Yeah.
It was just friends.
Yeah.
Like, these are my friends, but now it's like my friend group.
Yeah.
You've moved into this generation of talking, I noticed.
Yeah.
Yeah. You probably had to do that working with so many young people.
Yeah, and then also a lot of therapeutic terms have made it into pop culture, which I think is overall a good thing. People are more aware of mental health and they know the lingo a little bit more.
Yeah, I'm not there yet. I still say friends, but my daughter says friend group, so I'm trying. We're not there yet. Okay, what's your next reason that you think on here that athletes struggle mentally?
Yeah, a lot of athletes use their sport or use workouts as their main way to de-stress, to cope with whatever's going on. It's what they do, what they enjoy, and in many ways that's great. But when they're injured, especially if they have a concussion or some kind of serious injury, they really need to put working out to the side for a while. And if they don't have some other form of self-care or coping, they're going to be in trouble. So there's lots of like meditation, there's lots of other things that they can do, but a lot of athletes really rely on something physical, some physical activity, and then that makes it really hard for them when they're injured.
Yeah, I understand that. I am a concussion specialist. So when you say concussion, it relates. I actually just discharged a patient back to sport yesterday. And it was just so exciting for me because she's been out of her sport, which was softball, for like over 6 months. And, we've slowly weaned her back, but because of post-concussion syndrome. But yeah, I think one part for us PTs is, I can't wait to get to our tips, but is just, helping them to stay, encouraged through that process. So, but I can see how, if this is the way you cope, like this is actually how you de-stress. This, playing softball is how I de-stress and I can't play. Right. That's a struggle. That makes sense. Yeah. Okay. Any more for us?
Sure. Yeah. Well, there can also be a lot of pressure to get right back on the field, start competing again. Sometimes maybe an athlete can get injured during playoffs. And the team, everybody would really like them to be available for the next game so they can continue, or right before a championship, or something that's just personally important to them, maybe homecoming or something else like that. And, a lot of times athletes might not be fully honest with their physical therapist or their athletic trainer or whoever. And or maybe they can get subtle signals from their coaches or someone else that, yeah, we'd really like you back like ASAP. And yeah, and that's just really stressful.
Yeah.
And it can be hard to deal with, and that can lead to them coming back too soon and maybe just getting re-injured right away.
Yeah. The pressure to not let people down, peer pressure,
Yeah.
or even coaching pressure. I feel like a pressure from an adult, your parents, your coaches, that could be even stronger depending on who's putting that pressure on you. And especially not understanding like the injury and sort of what you're, if you don't understand the injury, then you're going to actually put more pressure on them too, because you're like, well, why can't you? You seem like you're fine. Like you can't, you can do this. Why can't you do that? So yeah, I can see that. Okay. Anything else?
Yeah, and oftentimes there can still be a stigma around mental health. Things are a lot better now. The newer group of coaches and athletes are a lot more aware of mental health. But that being said, nobody wants to be perceived as weak, or they still might just not really be aware of things like depression and anxiety. And when an athlete gets injured, we gave a lot of reasons already why an athlete could struggle mentally, and then they might not have the awareness to know, feeling sad or anxious is a normal thing that happens when you're taken from your sport and dealing with an injury, and then they might not know what to do about it, and that just makes it harder.
Yeah. I think there's so many great things that have happened in relation to mental health in the last several years. And I think that's helping people. I know more people than ever that are seeking out help for mental health issues. And so, but yeah, I mean, depending on who your parents were, like that comes along generationally. Like, your grandparents are like, I walked in the snow to get to school. And then your parents are like, I had to work and go to school at the same time. Well, so there's pressure that like, I could handle this. You should be able to handle this. And then people feel like, I shouldn't, why would I seek out help for this? I should be able to handle this. And I might be looked at as weak, or I don't even know who to go to or what my resources are. So education is important. That's why this is a really great opportunity for discussion and education to you guys out there listening, because, everybody has different exposure and understanding of how to get access and how to get help and what help might be needed. So I hope you guys are getting some good stuff out of this. Okay, so now that we've talked about the challenges, why people struggle, let's go into some tips, some of Dr. Jason's juju. So give us some tips. Let's go one by one. Tips to develop mental toughness. This is the good stuff. So what's your first tip for someone to develop mental toughness?
Yeah. And one of the things the ideas that a lot of athletes are starting to get more aware of is something called the growth mindset. And that's really helpful. In general, there's two different types of mindsets. There's the fixed mindset and the growth mindset. And in the fixed mindset, that's when somebody believes that a quality like mental toughness or athletic talent or ability or just anything like that is a fixed entity, and you either have it or you don't, and there's nothing you can do about it. And when somebody has that type of mindset, they're going to be a lot less likely to take on new challenges, to continue persisting through a setback, and they're going to think more along the lines of, what do I know I can be good at? And if somebody has a growth mindset, then they have the mindset that abilities or qualities can change through effort in learning. So that person is going to be a lot more likely to take on new challenges, bounce back from setbacks, and just keep going in spite of whatever happens. And it's really easy to go in and out of both mindsets. If somebody asked you, or if somebody said, ability in baseball is something you either have or you don't, then that can really quickly put somebody into a fixed mindset, and they could think, oh, do I have it? Am I good or not? But then if somebody says, ability in baseball is something that you have to work hard to get, then somebody will think, oh, how do I get it? What do I have to do? Or what can I learn? So it can be really simple. And it's just helpful for people to keep that in mind and try to keep focusing on learning and effort and trying to maintain that growth mindset.
Okay, that's a good one. Also, I only hire people that have a growth mindset.
Ooh.
So I think that matters with just being that kind of person in your life and be able to have opportunities. And because it's hard to hire and work with people that don't have a mindset that is a growing mindset, that you're flexible and that things are going to change. And so when you explain that so well, because I don't think I could have explained it like that. That was a pretty good one. Yeah. So develop a growth mindset, or work on developing a growth mindset over a fixed one. Yeah. Give us your second tip. What's your second tip?
Yeah. And this one goes back to a lot of, great sports psychology practitioners, like a guy named Ken Ravizza, who wrote a book called Heads Up Baseball. But just a really simple idea, but focus on controllables over uncontrollables. Like what are you in control of in your performance or in your life, in your recovery? You're in control of, doing the physical therapy exercises that you're prescribed, getting rest, drinking water, things like that. That's under your control. Things that aren't under your control, bad weather, possible setbacks, maybe insurance or different things like that can go wrong. And the more you can focus on what is actually under your control and do your best to pay little attention to what's not in your control, the more motivated you're going to feel and the better results you're going to get.
Yeah. This is life, right?
Yeah.
Life skills. Focus on controllables, because everything's not under your control, right? And if you can do that, that seems like that would be a great tip for developing mental toughness. Okay, tip number 3.
Yeah. So again, this is another thing that I stole from Ken Ravizza, and he probably learned from his mentors and stole from other people. But just knowing your why or your purpose. So athletes, there's a lot of other things they could be doing. They could be gaming with their friends. They could be sleeping in. They can be doing whatever, but they're choosing to work really hard for some reason, long hours and really hard work. So why? Why are they doing that? A lot of times it's pretty simple. They love it, or maybe they love the challenge, or there could be lots of reasons. But when you tap into that why and remember that, then it makes it a lot easier to keep doing all the hard work that you need to do to recover or do well in your sport or whatever it is.
Yeah. Know your why. Yeah. Have purpose.
Yeah.
Right? That's good. I love it. Okay. Tip number 4.
Yeah. So value-driven behavior. Yeah. Focus on value-driven behavior. So there's emotionally driven behavior and value-driven behavior. It's kind of what it sounds like. Emotionally driven behavior is when, if you feel happy, you're excited, you work hard and do all the things that you're probably supposed to do. Or you get excited and skip stuff, but your behavior is driven by your emotion. And then when you're angry, if you're angry at coach, maybe you skip practice, or you're feeling sad and you don't do your PT exercises. So that's emotionally driven behavior. You should feel sad
if you don't do your PT exercises.
And it's
your PT will be sad if you don't do your PT exercises.
Very sad, very sad. Yeah. And that's kind of what a lot of people do a lot of the time. That's pretty normal. But then there's value-driven behavior. And that's when, in spite of how you're feeling, happy, sad, tired, frustrated, you have your core values in mind, your core principles, maybe family, or maybe you value excellence in your performance or whatever it might be. And then you keep those in mind when you're making your daily decisions. And one simple example could be someone's tired, they don't want to do their PT exercises, but they value being a good teammate. So they think, okay, I better do these exercises so I can get back on the field and support my team.
Versus being just frustrated and like, you know what, this sucks. I hate life. I'm not doing my exercises. I'm just going to lay in bed and curl up and cry.
Right, exactly.
That was a good one, huh?
Yeah. I'm not saying you can't do that. You can do that. But afterward. Dust yourself off and do your
Right.
PT exercises.
Yeah, exactly. Dust yourself off and pull it together, right?
Yeah.
As quickly as you can, you'll feel better about that. Okay,
Yeah.
awesome. That was a great tip. Okay, tip number 5.
Yeah. So do your best to stay grounded in the present moment. A lot of times, if you're anxious, if you're struggling with something, a lot of times you're thinking about what's going to happen in the future and maybe feeling anxious, or you're thinking about what happened in the past, feeling frustrated or depressed. And if you can be in the present moment, usually things are okay. And that's where you need to be to do your best anyway. You're doing your PT exercises in the present moment, or you're performing in the present moment. So the more you can do things like that by, practicing mindfulness and other things like that, the better off you're going to be.
Awesome. All right. Tip number 6.
Yeah.
You're talking a lot. I'm sorry. Tip number 6. You're the juju. You have the juju. I don't have it today. We're getting it all from you. So give us that last great tip.
Yeah. So it's important to normalize mental health. So just like people get injured physically sometimes you get these mental or emotional injuries, and it's okay. It's just a part of life. It just happens. So if there's something going on, if you have test anxiety because final exams are coming up, or you just experienced a breakup and now you're feeling really sad and lonely and things like that, that's life. That happens. So if you can just kind of destigmatize mental health, it's a normal thing that just people go through, then you're going to be a lot more able to bend instead of break when those things happen.
Yeah. Because it's easy to tell people, like, this is what you should do. Here's all the tips, but we're human, right? And we have human behavior that goes between these. So that's why everybody needs support, right? When you're struggling with one of these things, it's like the same thing with physical therapy. Like, we can tell you to do these things, but oftentimes you need someone to take you through that process, help you through that process, and get you through it. So it's the same thing with, mental health, right? No different than physical health. So what would, if someone was come, and thank you for those 6 great tips. I appreciate that. That was great, Juju. What does treatment look like if someone, like, say our listeners have never had and worked with a mental health therapist or anybody who's a specialist? What does that look like for an athlete?
Sure. Yeah. And building mental toughness and working to address a mental health issue can look a little bit different. And it's kind of like the difference between physical therapy and strength and conditioning. Both are very important, but they look a little bit different. And if somebody has never been to therapy or received some kind of mental health help, the whole thing can sound kind of mysterious and weird. Like, what's going to happen? Is my doctor going to lie back and smoke a cigar and I have to talk about my dreams or something like that? So it just kind of seems weird for people who don't know. But for the most part, it's just an open conversation where you get to talk about things that are personal and private, and you're working with a professional and they're not going to judge you, and it's a safe environment. That's one of the main points, that your doctor's going to try to make you feel safe and let you talk about whatever's on your mind.
Got it. And the approach you use is cognitive behavioral therapy, which is what you kind of just said. That's the approach.
Yeah.
Essentially.
Yeah. And in cognitive behavioral therapy, one of the main points is to learn more about the relationship between thoughts, emotions, and behaviors, and how they all work together. And then you're never, like, one of the stereotypes that people might think is, like, with CBT, you're forcing yourself to think differently, even if you don't really believe it, or you're forcing yourself to think in a more positive way. But that's really not what we're doing. We're trying to learn. We're looking at the different situations you experience and just trying to learn, how is the way you're thinking and behaving helpful and not helpful? And let's see if we can kind of try out some new things and see if that's more helpful for your life.
I think I need to book a session. Okay, so talk to me about my daughter is you know this, but
Yeah.
she wants to be a sports psychologist,
Yeah.
and she believes that every person needs some mental health
Sure.
help. So she's been encouraging me. So I'm like, this is just going in that path. Okay, so what does a typical session look like? If someone has never had it, like what can they expect? They come in, do they call you and you meet them, it's for 10 minutes, 20, like what are you doing in the session and how long is it? And give us a little insight into that.
Yeah. So I mainly do telehealth, and then that can be a video or a phone call. Every once in a while, I meet in person when someone like really needs that, but we just have to work out the scheduling. And then the sessions are usually about 45 to 50 minutes long. Um, yeah, and well, it would start with an assessment where I'm just getting to know like what the person's dealing with, how it's impacting their performance or their life, and if it's an athlete, then we talk a lot about their performance history, like what's their performance that they're most proud of, what's their most difficult performance that they think back on and they kind of struggle with mentally maybe, and what's their why, like why are they doing this and how do they normally handle setbacks, and then that gives us both a really good understanding of their history and how their thinking and behaving is affecting their performance. And then we want to work on goal setting because everybody's a little bit different. Some people they just want to not have a panic attack when they go up to bat. Some people are recovering from an injury. So we want to get really specific on their goals.
Okay. And is it like is there a certain number of sessions that every person needs? Are you trying to hit a session? Are you like, how do you decide, and what is the typical amount of sessions you would work with one person?
Sure. Yeah. And that's going to really vary really widely. So and I'm speaking in a broad generalization, but if people don't really have a mental health history, like a history of anxiety, depression, OCD, different things like that, and they're struggling with something in the moment, like bouncing back from an injury, then that could be more of like a brief treatment plan, brief therapy, maybe being around 7 sessions, maybe fewer, just really depends. And then the other thing I would say is a lot of times people aren't really aware of their mental health history. Mm-hmm. A lot of people don't realize that they've been living with OCD or different things, and that just complicates things, just makes it longer. But if they have something like that, like performance anxiety, depression, things like that already, then they're probably going to need like 10 to 20 sessions to make significant improvement. And then a lot of people really like the support. Mm-hmm. So then they keep coming back and maybe once a month or so, or just here and there to get some help with whatever's going on in the moment.
Yeah. I think some things just take time. I don't think it's just a physical thing, like a physical healing, but I think time, sometimes we just have to have time to get used to something and to develop comfort and to be able to express. And so that might play a factor as well for you, like having enough time to get to the nitty gritty. Right. That's what I call it, the nitty gritty. I don't think I saw nitty gritty anywhere on here, but
it's in there. It's in there.
Well, it was so great. I know we did a lot of serious talk and you're used to comedy. So, and I can imagine if you are, used to doing some comedy, that your sessions might be fun, but we were keeping it pretty serious to get some information out to everybody. So, thank you for joining us today. Tell us a little bit about, if our listeners, followers wanted to find you and they wanted to get an appointment with you and they wanted to speak with you and get a session, how would they do that? How can they find you and how can they connect with you?
Sure. Yeah. Thank you. Yeah, this was fun. One sort of central location would be my website, drjasonvonsteitz.com. You could also find me on Instagram. My handle is @CBTSportsPsych. And then, you could also go to the group practice websites, cbtsocal.com and Mental Fitness Clinic. I forget the website. It's probably mentalfitness.com. But
Google search.
Yeah, exactly.
Okay, awesome. And what else? Let's see. I will include all that information in the show notes. So if you missed that and you don't want to rewind it back, just look in the show notes. You can find Dr. Jason from all those in there, and we'll put the right website for the mental fitness clinic so that they can find you there.
Yeah.
But yeah, we hope you guys enjoyed this this episode. If you're struggling with your mental health and you're an athlete, you got injured, and you need some help, and you're struggling, and you don't feel like you have the support system right now to move through this, reach out to Dr. Jason. He's here to help you. He does telehealth. You can really be in any part of the world and get some help from him. And I know there's a lot of athletes that listen and tune into this, so we would love to help you. So reach out to him because he's a great resource, and I think you'll find that you'll get to where you want to go. If you're struggling with a physical injury, here at Physical Therapy San Pedro, we would love to help you with your physical health and work you through that. So you can contact us on our website, physicaltherapysanpedro.com, our Instagram and Facebook pages at Physical Therapy San Pedro. You can look us up on Google, Yelp. You'll find us. We're all over the place. And so we would love to help you. And if this is your first time tuning into this podcast, the Physical Therapy San Pedro podcast, we have 55 more episodes. So go back and listen, learn. There's a lot of great stuff that you can learn from. And if you really enjoyed this, please share, like, subscribe, get this information out so you can help your friends and family and those that you love. Thank you for tuning in, you guys, and we'll see you next time. Bye.
Bye.